this gets us to the other side, that is microbiology. Much simpler this time because this was a repeat INI PYQ. I'm sure everybody is comfortable with this. A young male came after COVID infection. His maxilla was completely resorbed and it showed the presence of both septate as well as aseptate hyphae. You very well know that acute angle branching septate hyphae is a feature of Aspergillus. It shows the presence of acute angle branching and the classical septate hyphae. Whereas mucor shows aseptate hyphae, which are present at right angles. Broad aseptate hyphae present at right angles. This statement, broad aseptate hyphae present at right angles, was a recent NEET MDS PYQ also. So this was INI PYQ, that mucor one was NEET MDS PYQ. So fungi, numerous questions, simple, straightforward, numerous questions. So this was both Aspergillus and mucor. It showed the presence of both Aspergillus and mucor. Next question. Now, Vache, have a look at this image. The organism most likely is. So the minute I see this image, I'm clearly able to make out that all these cells are neutrophils, and the organism is intracellular. It is inside the neutrophil. Dekho, in the second image, it is even clearer. The organism is intracellular, making this as a case of Neisseria gonorrhea. Just a way to remember, gonorrhea, it's a sexually transmitted disease. Usme organism andar hota hai, it's inside. Just a way to remember. Neisseria meningitidis. See, gonorrhea is kidney shaped. It is a diplococci which is kidney shaped. Versus Neisseria meningitidis, which is lens shaped. Adjacent sides are parallel to each other. It is a lens shaped, mainly extracellular. It is associated with meningitis. That is meningitidis. Gonorrhea is kidney shaped, intracellular. So अंदर की तरफ है, intracellular है gonorrhea. Both of these are fastidious organisms. That is, they need special culture medium for growth. Gonorrhea is more fastidious than meningitis. Haemophilus influenzae, on the other hand, it is a cocobacilli. It is a gram-negative cocobacilli. Fair enough. Sufficient. Next question. IgE mediated is type 1 hypersensitivity. That is asthma or allergy. That is, it is associated with atopy. We have already seen that autoimmune hemolytic anemia is type 2. Serum sickness is type 3. Contact dermatitis is type 4 hypersensitivity. You know this. Achha, another important point is type 1 hypersensitivity. But the main cell associated is mast cell, followed by which WBC increases in peripheral blood? Eosinophils, followed by eosinophils, basophils, and T cells. So main cell is mast cell, followed by eosinophil, basophil, and T cell. Which is the main mediator associated? Histamine. You know that. Which is the main activator of eosinophils? I want you to commit to the answer. This simple line has been asked many times. So I want you to commit to the answer before I speak it out. Which is the main activator of eosinophils? A, B, C, D, E. E is the fifth alphabet, na bache? Interleukin 5 followed by 4. Main activator of basophils? B is the second alphabet. Interleukin 3 followed by 4. So I can safely say that the cytokines associated with type 1 hypersensitivity being interleukin 3, 4, 5. But which is the main cytokine out of these? All three are given in the option. You have to mark one. What will you mark? Interleukin 5. 5 because main WBC was eosinophil. 4 is going with both. It was in a relationship with 5. Main activator interleukin 5 of eosinophils. Next question. Straightforward. A bacteria survives boiling for 30 minutes. How? And it shows resistant to disinfectants. So how? It has spores, endospore. Which structural component is most likely responsible for this? That is endospore. See, lipopolysaccharides, endotoxins, teichoic acid, capsule, everything are the virulence factors with respect to microorganisms. But what gives it so much resistance? Endospores. That is why they are the most resistant to disinfection. But what is more resistant than endospores? prions, followed by Cryptosporidium cyst, followed by spores. You know the order of resistance. We have discussed it many times in numerous grand tests. Next question. Next question. Which is most effective for slicing heat-sensitive intravenous fluids? Which going wrong in such a question will be blunder. Autoclave, hot air oven pasteurization, all those involve heat. I'm not even going into the details that pasteurization is for milk or what are the various modalities of disinfection. You know those. Heat sensitive, what is left is filtration. We'll be filtering IV fluids, sera and vaccines because they are heat sensitive. Straightforward. We just saw intracellular gram-negative kidney shaped. This was what we discussed is Neisseria gonorrhoeae. Neisseria gonorrhoeae. It's by chance the same question which has been asked twice. Meningitis is mainly extracellular, intracellular Neisseria gonorrhoeae. Both of these are diplococci. You know that. And lastly, which cell is most important for cell-mediated immunity? That is, we are talking with respect to type 4 hypersensitivity in this case or cell-mediated immunity. It can be any cell-mediated immunity. It is the T cell. And which T cell? The cytotoxic T cell. Main cell responsible being the cytotoxic T cell. Helper T cell helps in granuloma formation. CD4 positive T cell, that is the helper T cell, it helps in granuloma formation. Whereas mast cells play an important role in type 1 hypersensitivity. You already know this. We have seen mast cell followed by eosinophil, basophils and T cells. B lymphocytes and plasma cells, on the other hand, play a role in antibody-mediated immunity. That is, they play a role in humoral immunity. So these are the ones which are associated with type 2 hypersensitivity. Plain and simple. So, bache, this totally takes care of our grand testual discussion. Simple, straightforward. Path, micro mein, you don't have to worry a lot. We have many things to worry about, but not path micro. So do your notes well, solve MCQs along with it, and you will be set. So on this note, bache, bestest of luck for the paper. It's just around the corner. Frankly, I'm loving the positivity which you guys are having at this point. Give it your best shot and let's get this over with. Thank you, and take care.